Hello, everyone. Good afternoon. Thank you so much for hopping on this diversity, equity, and inclusion call today as we focus on volunteer recruitment and engagement. We have a wonderful panel on today's call. This call is a partnership between the United Way of Southwest Alabama and the South Alabama Coalition of Nonprofits. And also, we are thrilled that the Alabama Power Foundation saw value in what we were offering the community and decided to sponsor our DEI efforts here at United Way. So, like I mentioned previously, we have a panel that is the three local gurus for all things as it relates to volunteer recruitment and engagement. And that is going to be led by United Way's very own Brad Martin. He is our program manager for the Volunteer Income Tax Assistance Program, and then also is lead on our Volunteer Connect platform. And so I will turn it over to Brad and let him introduce his panel and get this show started. So Brad, the floor is yours, sir.
Okay, and I hope that everything is working properly and you can see and hear and, everything. I'm coming through okay. Thank you for joining us today. I am very happy to have with us Lydia Gaudet from Goodwill Gulf Coast and Carrie Cohen from Victory Health Partners. And we wanted to talk about volunteer management because I think we've all been working with volunteers long enough to know that it is a factor in diversity and in inclusion. And volunteers make our programs go, but how we manage volunteers has a great impact on how that all goes. So I want to start with a little audience participation, and Lydia, if you will read for me when they do it. I want everybody to go into chat, if you will, and just type if you'll just type in the chat, what types of reasons do volunteers, what motivates volunteers to volunteer? Because that is you have a diverse group of things, and no two volunteers are the same. There are lots of factors that motivate volunteers to do work for free. And they do it so willingly and so passionately. So I'd like to know what you think are the reasons that people volunteer.
So paying it forward, giving back or making a difference, free t-shirt, food, drinks, etc. They're bored and they need community, sense of community, mission, their connection to mission. For example, having formerly experienced homelessness. Let's see, a purpose they connect with. Yep. Several people have mentioned that.
Mm-hmm. And a lot of those are great answers that I had not actually thought of as in my list. But they're absolutely
hours and free admission. That's another to an event.
Sometimes that does it.
That's
right. Sometimes it's the free admission. Sometimes it's the social connection. And we see this especially post-COVID. Sometimes people volunteer and end up becoming friends with the people they volunteer with, right? Some people volunteer so they can then afterwards go to lunch with their friends. Sometimes they get their friends involved. Come volunteer with me and then we'll go eat lunch. Some people volunteer because they're looking for leadership opportunities, right? They want to build those skills. They like managing a team of volunteers. Some people volunteer because they, as you said, connect with a purpose. They feel very passionate about an organization that they work with and they want to be helpful. They want to make a difference in their community. Carrie, Lydia, am I missing any? There are probably as many motivations as there are people on this planet.
I think also life stage, the stage of life that you're in, whether you're an up and coming young professional or you're finished with parenting or you're retired. So I think also life stage plays a lot of a part of that.
And that's a good point. And I will say to your point, college students and high school students do a lot of volunteering because they're
Mhm.
required to do service hours. Now, that gets into a different concept, which is unofficially a term we call voluntold. If you've ever been voluntold, it's when you've been signed up to volunteer for something, but you didn't actually volunteer for it. Sometimes people really get into the service angle. We see a ton of student volunteers coming from the University of South Alabama because their South Serve system ties into our Volunteer Connect system. Little shameless plug there.
Mhm. Mhm.
And so everything that we put in Volunteer Connect flows over to South Serves. And so we see a ton of student activity. Lydia, am I missing any? Maybe
No,
not.
I think you've hit the main things. The point is, compassion is a great motivator, but it's often not the only one.
Correct. And knowing what motivates your volunteers is often helpful to giving them a better experience, and knowing that some people are not motivated by the social. Some people volunteer to do data entry because they want to sit behind a computer and not talk to anybody, and that's okay.
Correct.
And knowing what motivates a volunteer and getting to know those volunteers on a specific and individual level is really crucial to maintaining those relationships and knowing what types of activities you have that those volunteers might want to engage in. So Lydia might meet somebody who's coming in to sort books, and through conversation figure out that she would make a great tax volunteer for Denise at Goodwill. And so, through that conversation, you might find that you can develop those relationships, or those people become your friends. And then when you're really stuck and you need 1,000 envelopes stuffed by tomorrow at 3 o'clock, you might be able to call and beg that volunteer for a favor because you have a rapport, because you know that that person won't mind stuffing 1,000 envelopes all day tomorrow, maybe, possibly.
Mhm.
And so I think those are all things to keep in mind, is that motivation for volunteering really drives that process. Lydia made a point to me, and I'd like you to expound on it a little bit, that being a volunteer manager is kind of like being a human resources department. And people don't think of us a lot of times as managers because we don't have necessarily a management title, but we manage a lot of people just on a volunteer level, not a staff level.
That's right. We had this past year 502 volunteers, just volunteers, not voluntold. There were some of those too, but we out of those 500 people, they had to be recruited, they had to be onboarded, they had to be assigned to a manager of some type. Somebody had to make sure they were doing their jobs, and problems weren't happening. They weren't locked out of somewhere. They had all the materials they needed. Somebody should follow up with those people and see how we did and what we can do to improve. And their pay, they don't get a paycheck. Their only pay is the reward of having either a job well done or a person served that they can see right in front of their face, and they know that they changed that person's life. All of those are HR functions. And one person can't be the HR department for 500 people. It takes the whole team doing this, and the whole team being able to accept those volunteers and let them into their space. Really, I mean, the people, I found that staff have a hard time kind of letting go of some of their own to-dos, because it also means they have to let go of control and leave it to somebody else to do that job that they would be a perfectionist about, perhaps. And that's hard to do.
And it is hard to do because, you want it, how you want something done, and you worry that, okay, if they do it wrong, then I've got to go back and do it all over again. And so the trick there, I think, is to know who, or to sort of size up who would be a good fit for a role, and then train them well, and then trust that they're going to do it. I had a coworker one time who we had recruited some volunteers from RSVP. And if you've ever worked with their office crew, they're just really fabulous about coming in and just knocking out a project. And my coworker was like, do I need to leave them? Do I need to like be in there and make sure they're, I said, nope. Tell them what you need, give them an example, and leave the room and watch the tornado happen. And when you get in, that everything will be where it needs to be. And if you can do that and you can make that happen, it's a great experience. Now, there's a thing is being too hands off. If people don't feel like they have direction and guidance, enough to know what they're doing, then they're not confident in what they're doing, and then that leads to a bad experience. But if you can sort of present the task, make sure that we have it in hand, and then just let it go, it a lot of times can get done very well.
And I want to make an additional point on that too. Quality is important. It's important that the volunteers that come are actually helping you to the degree that we can make sure that happens. But I'm also going to say there's huge value in just the community engagement. People don't necessarily even know you do that project. They don't know you have that program. And until they walk through the door and see it with their own eyes, they're not going to be a good ambassador for your agency. But they could be if they could get up close and personal enough to see that. And that in itself is valuable beyond measure.
Absolutely. And I would say the other thing I want to get to before, and I'm about to go to Carrie for something, but I want to say, keep in mind that volunteers are not hanging around waiting for your call. Like, they are wonderful people and they will help you out if they can, but they are not sitting at home waiting for the phone to ring. They may be volunteering for Lydia on Monday, Carrie on Tuesday, me on Wednesday, and somebody else on Thursday. And they might have Friday free if they're not having lunch with their grandkids. And so what you have to keep in mind is, so often I've seen where people sort of assume, oh, well, we have these letters we need stuffed, tomorrow. Can we get some people in here tomorrow? Probably not, unless you have the relationship that I was talking about earlier, where you can beg somebody that is generally helpful. I had a volunteer when I was in radio reading a long time ago. She was our volunteer coordinator. And so what we had was a schedule of volunteers to read magazines and newspapers and grocery ads and obituaries. And if somebody called and said, I've got the flu or I'm going on vacation, then you called Mary. And Mary was this lovely British woman who would call everyone and ask them. She had a little book and she'd call and then she'd leave a message on your voicemail that says, Regina will be in tomorrow at 8:00 to read for you, blah, 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 blah. And she told me one time, she says, you have to be really nice about it, and then you can swear later. And so she said, you call and you say, oh, I think it's lovely that you're going on vacation tomorrow. Have a lovely time. Damn. And I laugh because it's true. You can't make people feel bad because they can't help you, especially at the last minute. They are volunteers, they're not getting paid, and they're giving you what they can give you. And if you can make use of what they can give you, then you make use of what they can give you, and don't make them feel terrible if they can't give you more. And so if you've got a project, like letter mailing or whatever, try to set a date and give people time in advance. Say, we'll have the letters ready by the 20th. And so if you can come in on the 20th and then set that goal for yourself, and then have those letters ready, have those projects available when you tell the volunteers that you need them. If you call last minute, they remember that, and they remember that, you thought they were just sitting there waiting for the phone to ring, and I promise you they're not. Any points on that before I move over to Carrie for a minute? Carrie and I were talking in our pre-meeting about recruiting volunteers and being intentional about recruiting the volunteers who sort of represent and resemble the community that you serve. Carrie, do you want to talk about that in detail?
Yeah, so I'm with Victory Health Partners, and so we're a medical practice, which means we're there to serve everyone from all different backgrounds, cultural, social, economical backgrounds. And so, medicine and healthcare is very personal, it's very private, and there's trust involved, right? So if my team of volunteers, including my staff and medical personnel, does not look like the clientele that I am trying to attract, the likelihood of me getting that clientele in, the patient in through the doors, is even harder. Now in medicine, volunteers regardless, so we attract pre-med students, we attract medical students, we attract people who are on that med track, but we also attract RNs, retirees, and just people who want to give back to their community, and healthcare is their focus. It's very easy for me to find Caucasian volunteers, right? It's very hard for me to find Hispanic, African-American, and volunteers of different backgrounds and disabilities, simply because some of these volunteers are not thinking about volunteering in a healthcare environment. And so I have to be very intentional about it. And that means using my resources, which are my fellow volunteers, my staff members, my board members, to let them know, hey, so there are volunteer opportunities here for individuals of all backgrounds, and be intentional about it. I'm excited when I see different volunteers walking through our doors who may not fit what we currently have, because it's going to make it easier for our patients to understand that we are a facility for everyone. How do I track them? Well, word of mouth, being open about it. The worst thing you can do is not talk about something that you're working towards. I want people to know that I am looking for volunteers of all different backgrounds, and I don't want to be shy about it. And I think that's one of the best ways moving forward. I'm not trying to target one particular culture or one particular background. I'm being very careful about that, because then that kind of backfires. But we have to be willing to talk about it in order to attract different people, different backgrounds coming in. And I'm not just talking about young people, because we do have a lot of young college students here, but I want my seniors in here. I want my retirees in here, you know, and I want them to know that there's a place for them here if they want to come in and volunteer. And so I have to make sure that they're aware that there are projects here that will fit their skill level or their passion. And that means on my social media and when I advertise, I keep that in mind. I'm not just posting pictures of young volunteers doing this. You know, I'm posting pictures of, you know, my seniors doing things, you know, my Hispanics doing things, my African Americans doing things. If I have someone in a wheelchair, they're working on a project, I'm sharing that. I'm being very transparent, so that the community knows that if they're looking for an opportunity, that they can walk through these doors.
And I'll say to your
Piggyback
point,
on that, Brad,
go
if you
ahead.
don't mind.
Yeah, go ahead.
It's critically important that we work hard at this, because there's a certain communities that will step up to the plate without you calling and asking them, and others that do not. And if you are not recruiting volunteers from a number of different communities, that's less people that even know what you do. I mean, we rely very heavily on our volunteers saying to their friends, oh, you need to go to Goodwill for that, because I volunteered in that program. They don't know what we do. They think we have thrift stores. And so, you know, they're not going to find the GED class or the free books or the other things that we do if those volunteers don't go to their communities, which are not necessarily my communities, and tell them what we do so that more people can find the services that they need. Having a wider circle is critical.
Yes, my volunteers are a part of my marketing team, and that is the conversation I have with every single volunteer. I want to arm them with the information about my agency, because a lot of times our volunteers are in places that we're not. They're in rooms and family discussions that we're not. And I want to make sure my volunteers are armed with enough knowledge to be able to say, hey, have you heard about Victory Health Partners? You should give us a call. I volunteer there. Not only do I volunteer there, but they may be able to help you if you need to see a doctor. So there's two sides to it.
There's more than two, because I can tell you, your volunteers can be your assets in ways that you didn't expect either. And what I mean is, I had a guy who was working with me at one of our tax sites, and one of the other guys was working with a client, and the client was a Spanish speaker, and English was not only was it not his first language, he was having a hard time understanding what the first guy was talking about. And so the first guy asked him, what is your first language? And he said Spanish. He said, let's go talk to Sylvester. And Sylvester was able to convey what we were trying to do, and actually Sylvester took over the return. But B, the taxpayer felt more comfortable because he could have the entire conversation in Spanish, and that made him feel more comfortable. So by expanding your volunteer core, you by making people, I have a volunteer who says, when people come to you to get their taxes done, and it's true with medical as well. When you're saying this, I totally agree. People have to be able to trust you. They're laying their whole life out in front of you. And I never forgot her saying that. And I never forgot, that we don't know everything. The other thing I would say is, in terms of coming from different backgrounds, we are a driving city, right? I mean, we are not a public transit city by and large. If you're in DC, lots of people take the metro, right? If you're in New York City, lots of people take the subway. There are cabs everywhere. Of course, we all know about Uber, but basically we're a driving city. So I was working at a tax site, and one of my taxpayers was late, and I happened to know her, not as a friend as such, but I've done her taxes before, so I knew her situation a little bit. And the volunteers I was with didn't. And so they were like, well, I guess this one didn't show up. And they're looking at the schedule and she's not there. And I said, now hang on. What I know to be true is that she takes the bus. And what I also know to be true is that the bus tends not to always be really on time. So let's give a little grace. And let's see if she comes in. And she did. And what happened was she got off at the wrong stop and had to walk 10 minutes. Right? These are things most of us don't have to think about. Now, I kind of do because I don't drive. But, just being intentional about recognizing that, and this kind of segues into my next point, which is recognizing that the people that we work with and the people that we serve are wonderful people who just happen to be in circumstances we don't find ourselves in, and may never, and may not even be able to imagine. And that's okay. One of the things that I run into is, and I'm guilty of it too, is I run into clients who have not filed taxes in 4, 5, 6 years. I had someone the other day ask me if I could go back to 2013. And it's real easy for us to be like, how do you not file your taxes? And what I have learned over the years is that life has happened to people. It's happened to you, it's happened to me, but it's happened to them too, just in a different way. And I've had people, I often will say, if I've got a client who hasn't filed in 5 or 6 years, no judgment, but how did we get here? Because I don't want to take that approach of, how do you not file your taxes? But it is interesting to find out that some people started out. I had somebody tell me once, well, my mother, the first year I didn't file, my mother had passed away, and I was depressed. I couldn't get out of bed. I just couldn't do anything. That's a real thing. And then what happened? The next year they were embarrassed, right? Like they were just embarrassed because, oh my God, I didn't file 2014 taxes and now it's 2015 and who am I going to tell? And you just sort of get to where you overlook, you hope that it's sort of like, if I don't file it, I know I'm going to owe and I don't want to owe. And if I don't file it, then nobody knows I owe. And so you just sort of, how many times have you done that? Not about taxes, but about something, there's something not quite right. You need to go see a doctor, but you don't want to go because you know that they're going to tell you something you don't want to hear. So you just sort of ignore it. Right. There are all kinds of reasons people do what they do. It doesn't make me better than they are. And it's something that we have to explain to our volunteers, that you're going to talk to people who maybe they don't pay off their credit cards all at once. And maybe you do. Maybe they don't have a savings account. Maybe they don't have, and I'm talking financial because that's what the realm that I work in. You all have fields in which you work with volunteers and you work with clients who may not think the same way as your volunteers, or may not, we think payday loans in the finance industry are a terrible thing. We also don't have to rely on them. And there are people who have gotten into payday loans and maybe even payday loan traps. And we think that's a terrible thing, but it can help them keep the lights on. And so, yes, we want to help you get past that, but we don't want to judge you for it. And are there other areas that are not financial? Because I think financial because I've been doing finance for 12 years. But are there other areas where we tend to look at clients and say things we maybe shouldn't, because we can't fathom and we don't understand where they're coming from? And the point is, if there are, how do we teach that to volunteers? And I call it cultural competency.
Yes.
And just knowing, how to be sensitive to the fact that not everybody is you.
Well, Brad,
Go ahead.
in a healthcare scenario like we are in, we deal with a lot of individuals. One, they don't have health insurance. So a lot of times when they come to us, it's after a period of waiting before they address the issue. And most people who have health insurance, they don't think about it. If you're sick, they call the doctor, they go get it done. They do what they need to do to stay healthy. We interview every single volunteer before they actually get an opportunity to volunteer with us, because there's a culture in our facility that's very important. It's dignity and compassion and kindness. And it's something that is required by our staff. And we feel like our volunteers are an extension of our staff, which means I need to make sure that any volunteer that walks into our facility already have these 3 items as a part of their armor, because they're going to come across our patients who are making decisions that may have caused them to be unhealthy. And you're going like, why didn't you go see the doctor 2 months ago when you felt that? Well, that patient's not going to come back here. They're already felt bad enough walking in here because they know they delayed. And then to have someone look down, talk down on them will end up being not the environment that we wanted for that patient to experience. And so we talk about having compassion, having kindness. We talk about dignity all the time, because that's a culture that we want to have within the environment. And that is something that we want all our volunteers to have. And I think it's very important that if you have volunteers, that they're aware, they're in tune with your value systems for your nonprofit. You all have to kind of speak and walk the same talk. It's kind of like you hiring an employee for your company. That employee is looking to see if they're a good fit for this environment. And you as the hiree is looking to see if this employee is going to fit with your company. I think it's the same thing for a volunteer. I don't think every single person that volunteers is a good fit for your nonprofit. Okay, simply because what you do and what that volunteer does impacts your community. Does that kind of make sense?
Mhm.
I hope
It
that
does.
helps.
It does. And to your point, you know, I always sort of cringe when I hear a volunteer say, I'm just a volunteer. Don't ask me. You know, I'm just a volunteer. Don't
you're
ever say
not.
you're just a volunteer, because I like the statement you made that they're an extension of your staff. And then to your point about maybe this person's not a good fit, is there another role you can put them in? Maybe they don't need to be
Right.
patient facing, but maybe they
Right.
can, you know, they can sort out supplies or,
Right.
you know, other things. Are there other ways that you can utilize that person's talent? Because they may be a very great volunteer, but they just don't have the tact to be front facing, or
And
maybe they're great front facing people, but they may have a severe form of dyslexia where you don't want them doing numbers because they get numbers reversed and that kind of thing. So
go ahead.
no, go ahead.
I think a lot of it has to do with relationships. If you
Yes.
are so busy doing the business of your nonprofit that you don't have time to talk to a volunteer, you're going to lose that volunteer. Volunteers stay in an environment where they are comfortable and they enjoy what it is that they're doing, regardless of what their motivation is to join your organization. In the end, if they're not comfortable, if they don't feel like they're needed or wanted or seen, most likely their time with you will be short. I make an effort every single day, no matter how busy I am at my desk, to walk out into the clinic and talk to every single volunteer that's there that day, even if it is just to say, hey, good morning, how are you? And if I notice there's a volunteer who likes to talk about their children, I stop. How is Sally doing? Those little 2 seconds, 5 seconds conversation makes a person feel welcome and seen, which means the likelihood of them staying with you long-term increases.
And I have such a great story about that. And then I want to move to Lydia for a minute. But I want to tell you this story. I was in my former life, my former job was in radio reading for the blind, as I said. And I had a volunteer who was a good volunteer. But if something came up, he might call at 9:15 and say he wasn't going to be there for his 9:30, or he might not call. And I could not read the paper. If I could read the paper, we wouldn't need a service for the blind, right? Because I'm totally blind myself. So I really needed him to be present. And if he couldn't be present, I needed to know in time to call Mary, right? And have Mary call and say, oh, it's lovely that you can't come in. Damn, right? So I needed to know. And so we had that conversation. Well, a few years later, we were having a fundraiser and it was requiring a lot of volunteers to come and answer telephones. If you've ever listened to public radio and you've ever heard a pledge drive, you know it's the volunteers answer those phones for 10 days. And our new development director was like, how do you do it? How do you get volunteers to come in? I so many of mine haven't shown up. And the guy I was talking about earlier said, because we know if we don't show up, we're going to get a phone call from Brad saying, where are you? We need you here.
Yes. Yes.
And I don't say that to say that I'm, you know, a nag, but it's important that, you know, your work here makes a difference. And
Yes.
if you're not here, maybe I can cover for you. Maybe I can't. And maybe that means somebody doesn't get served. And so that's a key, is for them to feel, as you say, that their time there is necessary, it's needed, and they're not just a volunteer. Lydia, I want to talk with you about, because I think you have a lot of experience with working with volunteers, either volunteers with disabilities, but also serving persons with disabilities and helping them to know, because we had a session a few months ago about working with people with disabilities, and cultural competencies are really critical. People get really self-conscious working with blind people sometimes because they don't want to say, oh, I saw this on TV last night. They don't want to, you know, offend someone by saying the wrong thing. And then they say it and then they think they've offended you and then they just shut down. So do you guys have conversations about that before volunteers work with, say, maybe your Kaleidoscope program or some of your other programs that to help them feel comfortable with those conversations?
I learned this early on when I first, now I manage volunteers for any program that we have at Goodwill. But when I first came on board, it was a tutoring program to help people who need to learn to read better. And they would come to us and maybe reading at or below third grade level. So it was a significant jump they needed to make just to be able to read their medicine bottles or the labels in the grocery store, the signs on the road. I mean, people, so I put a lot of effort into making sure, number one, that my volunteers understood the mountain they climb every day trying to engage with their world when they couldn't read the print in front of their eyes. Another thing I always had to help them understand was these people, some of them made 3 times my salary. They had businesses, but they couldn't read, they would have somebody else do all their contracts. And sometimes they got taken advantage of because of that, because they didn't really know what they were signing. They had to trust the person to be telling them the truth about those contracts. And also it was often a transportation issue. If somebody has a disability and they're not working outside the home and they're trying to improve their state in life, they may have to take 3 buses to get to the library that's by your house and you have a car, so you may need to, bend some and go to the library where they are, but they also may not want to go to the library in their neighborhood because they don't want their friends to see them there and understand that they're getting tutored in reading, so the answer to that question is ask, just ask them what they prefer and get to know their preferences. So when I was managing volunteers, there were local agencies that served maybe people with severe disabilities, and they needed something for them to do, just activities for them to do. And they would want me to get them a tutor because that was a place they could go and some time they could spend outside of their apartment, which is important. But I had to ask myself a hard question. And having a son with Down syndrome myself, I kind of likened it to a teacher who purposely goes into special ed versus a teacher who was just going into regular ed and then gets all these special ed students put in her class. It's like one, you were expecting it, and in another case, you weren't expecting it. A mom like me, I wasn't necessarily expecting it, and I had to learn that I had to go through that learning curve. And I realized that my volunteers, as much as I was comfortable with disabilities, aren't necessarily that comfortable with disabilities. And they were going to have to go through the same learning curve I went through to learn what it is. They can do fine if you'll just count to 5 before you expect them to answer, for example. They're not ignoring you. They just are processing much slower than you're expecting. Or they may need a little bit of warning before you change the routine you've always done, or, various different things like that. And those things can be trained as long as as you take the time to do it.
I think you do your volunteers an disservice if you don't take the time to educate and share, because in essence, my volunteer who lives in West Mobile may not understand the challenges that a volunteer who lives in Pritchard or a patient who lives in Pritchard, right? Because that volunteer who lives in West Mobile never walked or experience the things or the life challenging things that the other one did. So I can't expect my volunteers to completely understand all the challenges that my patient experienced before they ended up in the door. And so I think not only myself, but my coworkers and my staff all need to understand and share so that our volunteers are equipped and knowledgeable enough to represent us when I am not in the room, because I can't be in the room and be with them every single day. They need to, again, walk the talk of Victory Health Partners. And that is my responsibility, and not just mine. Your coworkers and your staff need to be on board. We talked about HR and human management and your coworkers have to be a part of that conversation to be able to have success with retaining volunteers. It can't be just you, the volunteer coordinator.
And I think what I'm hearing from both of you is that it's not so much about saying, okay, you're going to have this situation and you're going to have this situation and you're going to have this situation and this is how you handle it, because you can't possibly, because again, going back to the concept of diversity, there are as many experiences, there are patients, as there are clients, as there are volunteers. But what you can do is kind of level set, right? Manage expectations. I tell people when we're going to start training for taxes, you may do taxes in one day. You may start with a client who's a college student. You may then move to a client who is a retired teacher. Your next client could be someone who is experiencing homelessness, and your next client could be somebody who just got out of prison. And you know, you'll get used to the very shifting of the conversations. You'll get some clients, forget things like that. You get some clients who want you to go over every line of the tax return and explain where did that number come from and why isn't it this number. And you'll get some clients who are like, yeah, just let me sign it. And it's, you know, you'll have some clients who you may think need financial education, and they may be receptive to it. You may have some clients you think may need some financial education and they're not receptive to it. And so it's about level setting. It's about managing expectations and saying, these are the kinds of things you may encounter. And I can give you some guidelines, and I can tell you, you know, for example, around persons with disabilities, don't be self-conscious, and they'll let you know if you have said the wrong thing. And I mean, be aware, be self-aware, but don't be, you know, paranoid about saying the wrong thing, or just don't be crippled with fear by saying the wrong thing. It will come out and you'll grow from it. And so I think a lot of it is level setting and managing expectations. Does that make sense?
I think
Yes.
another topic that is important to consider is that volunteers can create an opportunity for, instead of a transactional interaction with somebody, it can be transformational. They can go that extra mile for that person. They can spend the extra time to listen. They can care about whether this person's journey through your services, whatever they are more than what you would have had time to do if you were trying to serve everybody by yourself. It's more than just a numbers game. It's more than the number of people that you can serve. It's also how well they were served
Yes.
by this person. And when they understand, I mean, most of us, you know, Brad, when somebody comes to you to get their taxes done, they're hiring you, even though they're not paying you, to just do their taxes, just do my taxes, you know. But if that volunteer can connect with them on a deeper level and help them understand more about what this could really mean for next year or for tomorrow,
Yes.
that is transformational.
Yes, it is.
Our volunteers, we have a lot of young pre-med students, and I started with Victory in January, and I was just in awe at how our volunteers, what they bring to the table here. And I can tell you a story where I've had a young volunteer reach out to me about 2 months after I started here, and he said, Miss Carey, I noticed something and I have a plan. And I said, okay, what's your plan? She said, I noticed that when we have patients who speak different languages, which means English is not their language, they either show up for their appointment, they miss their appointment, or when they do show up, they have a 6 or 7 or 8-year-old child with them who's interpreting for them when the doctor's talking to them. And she said, what if I was to get our pre-med honors students who speak different language together and create a program called Translating Victory? And I said, put it together as a proposal. We'll share it with Dr. Lightfoot and we'll see. 6 months later, we now have a program where the pre-med student is paired up with a patient from the minute the patient walks in the door to the minute the patient leaves. We're now creating marketing and new patient packets that is Spanish and Vietnamese. My volunteer who is 19 years old brought this to the table. And I was just in awe because I underestimated that volunteer. And so when your volunteers come in, it's amazing what else that they bring in with them. And if you share with them your passion and what's going on here by educating them, making them feel a part of, it's amazing what you will trigger from that. And this is an example of a young person thinking deeper, seeing something, coming up with a solution, not being afraid to approach us with a solution. We adapt the solution, and now we have something to offer to our patients who are bilingual.
That's
or
incredible.
don't speak English as
That's
their first
incredible, because you're absolutely right. We see this with deaf clients as well, where sometimes their kids are having to interpret for them, and that's
Right.
complicated. That's rough if you're talking medical stuff, not to mention stuff you may not want your kids to know about.
Well, they're missing school. They're pulling
Well,
them out
that
of
too.
school.
There's so many
To do
things that
that.
we don't even, again, we don't think about, right? Like we
No.
just don't have to. We don't have to get through life. And I find that, you know, there are just so many things that we can learn if we listen to the people we serve as well as to our volunteers. We have about 10 minutes left. Are there any points that either of you want to make that I have not touched on? And then we'll open the floor to questions as well.
I think time management, one of the things that I work really hard on is to make sure if I have volunteers here that I have something for them to do, that I have planned something for them to do. One of the things I think is disheartening for a volunteer is when they agree to volunteer and they come here and we don't have anything for them to do.
Yes.
So
Yes.
I think be intentional, not just about looking for volunteers, but making sure they're just not a body, that you actually have things for them to do.
And that
So
you,
they're not wasting their time.
and the trick to that is assessing how much help you need. Do you really need 8
Mhm.
volunteers to do this project, or do you
Right.
need 3?
Right.
That's right. I think we've also found it helpful to have a range of volunteer types of jobs, because some people really, especially the college kids or the high school kids, even junior National Honor Society, middle school kids, need something real short that's a few hours. They can come in and do it and then they're finished. But it's also the type of project that can open the doors to people not realizing that they there's so much more that they could find if they needed it. But I also, think that there's a lot of people who really want to spend their time just impacting that person's life in a much deeper way. How much does it matter to a tutor that their student they've been tutoring can now read the newspaper, fill out their daughter's birthday card all by themselves? I mean, this is what they came to us for, and that tutor made that difference. And there's people that will stay with you forever because they're seeing that happen.
Absolutely. Are there any questions either in chat or if you want to take yourself off mute and just share? I'm hoping we've given you some good information, but if you have questions, we want to answer them.
Diane has asked a question. Let me go ahead and read that to you. Have you ever had to fill volunteer positions that included tasks that were unattractive to volunteers, such as staying up all night to monitor the shelter or washing dishes and taking out the trash?
That
Yes.
is challenging.
You don't care.
It's challenging. I think
It is.
it's again finding the right volunteer for the right task. You have to find the volunteer who has that passion for your organization. And when they have that passion for the organization, usually they'll go the extra mile. They'll do the uncomfortable thing. And that is the part that's hard, because it's a unique pool of volunteers. You have the volunteers who do it because they do it. And then you have the volunteers who are going, like Brad said, I can call them at, 5 minutes before something and they're going, Carrie, I'm going to be there in 5 minutes. And not everybody has that flexibility or has that kind of passion. And so it's searching. My front desk, I know there's a certain type of volunteer I need there. Not every volunteer that comes through my door is a good fit for my front desk, and so it's just continuously beating the bushes, creating relationships, talking to people, letting them know what you're looking for, because you'd be surprised someone said, hey, I have a friend, she's been looking for something to do. Let me reach out to her. I'll put you in contact, and you go from there. But it's hard for those tough jobs.
Well, it is, but again, it goes back to level setting, right? So one of my former roles, I was the program coordinator for volunteer guardian. That was a job where we were trying to find volunteers who would be legal guardians for incapacitated adults. You want to talk about hard jobs?
Yeah.
You got to decide whether the person gets a do not resuscitate order. You got to decide whether they have hip replacement surgery. But there are people who will do it. Now, if there are people who will take on that project, there are people who will take out the trash. The thing is to let them know that's part of the responsibilities of volunteering. I know people who love to volunteer at the animal shelters, and yeah, they love to play with the dogs and whatever, but cleaning out the kennels is part of it. Making sure that you let people know that's the expectation or that's part of the job. Or, so shameless plug here, in Volunteer Connect, we tell people, be very clear when you're writing a need description about what you need them to do.
Yes.
If you need them to come in and stay up all night, let them know you're not going to be napping, and just be intentional about what you're asking them to do and let them self-select. And you will find, as Carrie said, there are people who recognize your organization needs those roles and they can fill those roles. And it may be a challenge, but the worst thing that happens is when people come and they think they're getting to play with puppies all day, and then they find out they have to clean out the kennels, and they're like, this is not what I signed up for. And so I think managing, again, it's so much about level setting and setting expectations.
So I'm going to add 2 things to what you just said too. I think 2 things that would be helpful for volunteers who do either occasionally or often have to do those hard jobs is, number 1, try to mix it up with some tasks that are a lot more rewarding than just that. Let them be the ones to chat with the people next time, which brings me to point number 2. You don't want to have too many volunteers where they're sitting around, but on the other hand, you don't want to have too few. I personally volunteer on the weekends, and 3 hours, there's 3 separate hours that have to be covered. Well, I'm covering one of those hours every single weekend. Okay, so it would be nice if there was somebody who could spell me every now and then. If I have to go out of town or I don't feel well that way, I've got somebody I can call. So if you've got the hard jobs, get enough people so it's lighter work, or that they can do 2 hours and then go do something fun while somebody else takes it for 2 hours. It's twice as much work to recruit 4 volunteers instead of 2, but it just makes the load a lot lighter, and those 4 people can actually interact with each other, which also helps. And so don't think just because you can power through it for 12 straight hours that everybody else can power. They're not getting a paycheck for those 12.
Yes.
So you might need 4 times the people so they can each do 3 and get it through that way. So
so much good information. Anybody else have a question? We got about 4 or 5 minutes left. We could answer one in that, maybe 2.
And then Brad, we also have a poll that we'd like to close out with.
Okay.
Keep that in mind.
I will keep that in mind. Do we have any other questions in chat or anything?
no more in chat right this minute.
Not really a question, but more like a suggestion. I highly suggest that to volunteer yourself for another organization so you can start gaining that understanding and empathy of what it's like to be a volunteer. That will also help you strengthen your own volunteer program and outreach. Be like, oh, well, when I volunteered for that organization, I wish they would have told me more about what I needed to do, or I wish they would have made me feel appreciated more. So if you can, definitely volunteer anywhere you can.
And Brian, that's a really good point, because one of the things that I always ask people when we're interviewing prospective employees is, tell me about either a really great, wonderful volunteer experience you had, or a not so great experience and how you handled it. And so, I think volunteering, there's so many goals, there are so many advantages to doing the volunteering, even if you're a volunteer manager. And that certainly is one of them. You kind of know what you want and what you don't want to be. Okay, well, Trista, I'll let you run the poll, or Leslie run the poll. We have about 2 minutes left. So there's a poll. I want to thank you. The poll has been launched. I hear that. Go ahead. I'll let somebody take over because I can't hear what we're doing at this point.
You're fine. Thanks, Brad. So yes, if you would take a few moments and share your feedback on this DEI presentation, and then also any other feedback that you'd like to share in the chat, we greatly appreciate it. And again, this is put together through a diversity, equity, and inclusion committee that's representative of United Way partner agencies and also agencies from the South Alabama Coalition of Nonprofits. And so we are thrilled that this group comes together to share their ideas and their talents to ensure that we have the free resources to share with the community. So
And
thank
I want
you
to thank.
all for
I was
joining
I
us.
want
Go ahead, Brad.
No, I was going to say, I want to thank Carrie and Lydia for joining us today and sharing and making this conversation move forward. I often say that I could talk to a wall, and I probably have on occasion, but it's a lot more fun to work with people who are professional and passionate about what they do and share information as a group. And I want to thank you both for agreeing to do this today. And I really think we've covered a lot of ground today. So thank you.
Yeah, wonderful. And last but not least, we would not be able to do this without the sponsorship from the Alabama Power Foundation. So again, we're happy to partner with them and continue this meaningful work in our community. So it's Friday, guys. Go enjoy the rest of your day. Thank you so much for